We've been getting a lot of offices reach out to us who are already doing 10, 20, 30, even 50 appliances a month. And their question to us is, what's different about your program and what's this going to be able to do for us? Now, I will say, if you're already doing 10, 20, 30, 40, 50 appliances a month, most likely you're not advertising, and a majority of those are coming from referral sources, physician referrals. The difference between those patients and patients that you're going to attract through a targeted advertising campaign is the patients coming in through a targeted advertising campaign, they don't know, like, or trust you yet. So you have to do something in order to gain their trust. Oftentimes, that is a free consultation. And what you need to do to get those people to actually commit to that is go above and beyond in your delivery of value. And oftentimes that comes in the way of some sort of communication from the doctor or a personal interest that's been taken in the patient's life by your sleep staff.